Meet Ravi, a 35-year-old software engineer. He wakes up one morning with sudden severe pain in his right flank, radiating to his groin. He feels nausea and an urgent need to urinate and notices blood in his urine. Concerned, he visits the hospital, where imaging reveals a 6mm stone lodged in his right ureter. This case highlights how kidney stones can cause sudden, intense symptoms and why timely diagnosis and management are crucial. Kidney stones are a common and painful urinary condition affecting millions worldwide. Understanding their causes, types, and management is essential for both patients and healthcare providers. What are kidney stones? Kidney stones, or nephrolithiasis, are hard deposits of minerals and salts that form inside the kidneys. They can occur anywhere along the urinary tract, in the kidney, ureter, bladder, or urethra. Stones vary in size from tiny grains to large staghorn calculi. Incidence: approximately 5–12% of adults develop kidney stones in their lifetime. More common in men, typically between 20–40 years. Recurrence is common, about 35% within 5 years without preventive measures. Kidney stones are classified based on their chemical composition. Calcium oxalate, 60–75%, dark brown to yellow-brown, hard and jagged. Calcium phosphate, 10–20%, off-white, grayish, faster growing. Uric acid, 10–12%, yellow to reddish-brown, radiolucent, can sometimes dissolve medically. Struvite, 7–8%, chalky white or gray. Infection, related, often large staghorn stones. Cystin, 1–2%, amber, tan, rare, and hereditary. How stones form? Stones form when urine becomes supersaturated with minerals, leading to crystal nucleation, formation of a seed crystal. Aggregation and growth, crystals stick together. Retention in the urinary tract, forming a stone. Acidic urine favors calcium oxalate and uric acid stones. Alkaline urine favors calcium phosphate and struvite stones. Modifiable risk factors: low fluid intake, concentrated urine, high salt and animal protein intake, obesity, diabetes, metabolic syndrome, excessive tea, coffee, or sugary drinks. Non-modifiable factors: male sex, age 20–40, family history or prior stones, genetic disorders like cystinuria, medical conditions, hyperparathyroidism, gout, chronic diarrhea, recurrent UTIs. Medications: some drugs like topiramate or indinavir may increase risk. Sites where stones can occur: kidney, in colices or renal pelvis, ureter, commonly at pelvi, ureteric junction, vesico-ureteric junction. Bladder, often due to obstruction, enlarged prostate or neurogenic bladder. Urethra, usually migrated from bladder, causing urinary retention. Urethra, usually migrated from bladder, causing urinary retention. Symptoms of kidney stones include severe flank pain radiating to groin, hematuria, blood in urine, nausea and vomiting, urgency, frequency, burning during urination, fever and chills, suggest infection, emergency. Home and initial management. Hydration: drink 2–3 liters of water daily to maintain urine output. Citrus water or lemon water increases urinary citrate. Pain control: NSAIDs like ibuprofen or naproxen. Hot packs to relieve muscle spasm. Medical expulsive therapy: alpha blockers, for example tamsulosin, may help stones 5–10 mm pass. Dietary management: increase fluids, normal calcium intake with meals, reduce salt and animal protein, avoid excessive oxalate foods, spinach, beetroot, chocolate, nuts, limit sugary drinks and alcohol. High risk or recurrent stone formers: maintain urine alkalinity for uric acid stones. Potassium citrate supplements, if prescribed. Treat UTIs promptly to prevent struvite stones. Metabolic evaluation and 24-hour urine analysis recommended. Ayurvedic and supportive remedies: citrus fruits, lemon, lime, orange, increase citrate. Coconut water and barley water, mild diuretic, improve urine flow. Herbs like gokshura, varuna, punarnava, diuretic, anti-inflammatory, support urinary health. Only adjunctive, not a substitute for medical treatment. Surgical and procedural management. Stone size determines treatment is less than 5 mm. Often pass spontaneously with hydration and alpha blockers. 5–20 mm. ESWL, extracorporeal shockwave lithotripsy. Shockwaves fragment stones is greater than 10 mm or difficult location. Ureteroscopy with laser lithotripsy is greater than 20 mm or staghorn stones. Percutaneous nephrolithotomy, PCNL, rare complex cases. Open surgery, pyelolithotomy, nephrolithotomy, nephrolithotomy, ureterolithotomy. Open surgery, incision to remove stone directly, longer recovery, more pain, higher risk of bleeding and infection. DJ stent, double J, temporary tube from kidney to bladder to allow urine flow, used post-surgery, obstruction, or ureteral edema. Symptoms: frequency, urgency, mild hematuria. Nursing: monitor urine, Maintain hygiene. Remove on schedule. Suprapubic catheter. Bypass urethra in obstruction. Other catheters. Foley catheter. Temporary bladder drainage. Suprapubic catheter. Bypass urethra in obstruction or long-term use. Nephrostomy catheter. Drains obstructed kidney. Prevents damage. Nursing care. Maintain hydration. Monitor catheter. Drain output and color. Watch for fever, pain, urinary blockage. Remove devices as per protocol to prevent infection. Complication from stones, obstruction, hydronephrosis, kidney damage, recurrent UTIs, pyelonephritis, chronic kidney disease. From treatment, infection, bleeding, ureteral injury, residual fragments. Prevention. For everyone, adequate hydration, balanced diet, normal calcium, low salt, moderate protein. Avoid high oxalate foods in excess. Treat infections promptly. High-risk individuals. Bedridden. Early mobilization. High fluid intake. Post. Surgery. Monitor urine. Avoid prolonged catheterization. Elderly. Monitor bladder emptying. Treat obstruction. Climate sensitive. Schedule water intake. Prevent dehydration. Ayurvedic. Supportive measures. Lemon water. Coconut water. Barley water. Gokshura. Varuna. Punarnava Zadrungs. Lifestyle. Maintain healthy weight. Avoid excessive sugars and alcohol. Common myths versus facts. Myth. Avoid calcium. Fact. Increases stone risk. Myth. Beer prevents stones. Fact. Causes dehydration. Myth. All stones require surgery. Fact. Small stones may pass natural. Myth. Herbal remedies dissolve stones. Fact. Only adjunctive. Myth. ESWL works for all stones. Fact, size and type dependent. Kidney stones are preventable and manageable with proper hydration, diet, medical care, and lifestyle measures. Early recognition, timely treatment, and adherence to preventive strategies reduce recurrence and complications. Remember, consult a healthcare provider before trying any herbal or alternative remedies and follow medical advice for stone management and prevention.
Please do like, share, and subscribe for more videos.